Good day. So we're about to discuss our assigned topic, which is wisdom teeth. So I'll define what is wisdom teeth. Wisdom teeth are the last of your teeth to appear or erupt in the mouth. So normally we have four wisdom teeth, two in the upper jaw and two in the lower jaw. Wisdom teeth can lead to problems if there isn't enough space for them to surface or they come through in the wrong position. The picture shows how impacted wisdom teeth looks like, and as you can see, it is surrounded or near to your gums and jawbone. So next is the etiology or the causes. So wisdom teeth can cause a lot of pain due to the fact that if your teeth is growing at an angle towards your other natural teeth, this can cause problems such as crooked teeth and severe pain. Another cause is the jaw is not big enough to accommodate the new teeth and direction of tooth growth. So as you can see in this picture, if wisdom teeth will not be removed or treated when it erupts at an angle, it can damage surrounding teeth and can cause misalignment. Clinical manifestations, signs, and symptoms.
We have red and flame gum near the wisdom tooth. So have you know what is pericoronitis? Pericoronitis is the inflammation of the gum tissue around your wisdom teeth. So this can happen when a tooth is still partially impacted. And then the gums around the wisdom tooth can become infected. This is called also a pericoronitis. So why pericoronitis occur? So this will occur when the wisdom tooth do not have enough room to erupt through the gums. As a result, they may only partially come through the gum, which may lead to the inflammation and infection of the soft tissue around the wisdom tooth. So how are we going to treat inflamed gums? So we can apply an ice pack or cold compress directly to the swollen area, and we can also mix 1 cup of warm water and with 1 tablespoon of salt. Then we can also use baking soda and then also garlic and other treatment of the red inflamed gums near the wisdom tooth. So the next symptoms is facial swelling. So facial swelling is a common symptom with a range of possible causes. This includes injuries, allergic reaction, and infections. This occurs due to the enlargement or inflammation of facial tissues. So the question is, how long does facial swelling last? So according to what I have searched, it will take 3 to 7 days to heal. If the face has bruises, it will also take 10 to 14 days to fade. So how to get rid of swelling in your face? So getting more rest, increase your water and fluid intake, applying a cold compress to the swollen area, taking the appropriate allergy medication, and so on. So the next symptoms is pain and sensitivity. Pain and sensitivity of the teeth are typically the result of worn tooth enamel or exposed tooth roots. Sometimes, tooth discomfort is caused a cracked or chipped tooth, a worn filling, or gum disease. Pain and sensitivity of our tooth occurs when we consume hot, cold, sweet, or sour foods, drinks, or even breathing cold air. So how to get rid of sensitive pain? So we can use honey and warm water, hydrogen peroxide mouthwash, turmeric, salt water, and you can rinse it, and so on, other treatment of the pain and sensitivity.
Swollen and sore lymph nodes underneath the jaw. Swollen lymph nodes, commonly known as swollen glands, usually occur as a result of infection from bacteria and viruses. If you have swollen lymph nodes in addition to gum inflammation or pain, it is possible that you're experiencing a wisdom tooth infection. To prevent the infection of wisdom tooth, take antibiotics, and removing an infected wisdom tooth will often relieve the pain and swelling of the glands. Next, difficulty in opening the mouth and swallowing. Misalignment due to the wisdom teeth can also make it difficult to open and close your mouth. As a result, you may experience pain while chewing or biting. For example, patients with infected wisdom tooth have difficulty eating. They experience intense pain when biting and chewing, and symptoms like swelling, jaw spasms, and gum pain make eating uncomfortable as well. While a diet of soft foods may help the food taste, caused by pus seeping into the mouth can make any food unappetizing. Next, food getting stuck and difficult to clean out and bad breath. These teeth are far in the back of the mouth. The location of these teeth makes them difficult to floss and brush. Food and bacteria can get stuck between the wisdom tooth and the tooth next to it, making the tooth decay and gum infections called pericoronitis. Pericoronitis is an inflammation of gums around a partially erupted tooth, hence its common association with wisdom teeth. It usually occurs in and around the little flap of tissue over the tooth. Bad breath is a typical symptom of pericoronitis. It can also be painful or cause swelling in parts of the face. Where pericoronitis is advanced enough, may people will experience difficulty biting, chewing, and closing their mouth. Next, fever. When you get any infections, a fever is usually one of the first symptoms you experience in wisdom tooth. You may have a fever or chills as your body works to fight off the infections.
So, hi everyone, I am Melca Tobilla. I was tasked to present the laboratory test or the significance to condition. In some cases, impacted to wisdom teeth may cause no apparent or immediate problems, but because they are hard to clean, they may be more vulnerable to tooth decay and gum disease than other teeth are. Impacted wisdom teeth can cause pain or other dental complications are usually removed. Some dentists and oral surgeons also recommend removing impacted with wisdom teeth that don't cause symptoms to prevent future problems. Here are laboratory exams that can be applied in removing wisdom teeth. We have the panoramic x-ray. In a consultation of wisdom teeth removal, the use of panoramic x-ray or orthopantomogram is important in helping to identify impacted wisdom teeth. The panoramic x-ray is the preferred x-ray method because it can scan the entire upper and lower jaw from ear to ear in one shot. The x-ray machine has a rotating arm that moves around the head to catch the single two-dimensional image. With the process of taking around a minute, its ability to capture a complete picture of the mouth in a very short time makes it very useful for dentists to identify issues for treatment and offer a speedy diagnosis. Alongside helping to assess wisdom teeth, the panoramic x-ray can also be used to discover jaw problems and plan treatment for dental implants. Through this type of X-ray is favored for ease of use, it's not so efficient in the way of cavity detection unless the decay is deep. The panoramic X-ray procedure is safe, exposing patients to the machine's radiation for only 5.5 to 22 seconds. The way or the other dental X-rays used to capture images for the teeth are the bite wing, periapical, and the occlusal.
So coronectomy. Coronectomy is a technique of removing the crown of the tooth but leaving a part of the roots untouched. So the crown of a tooth is removed and fissure burrs are used to reduce the remaining roots to be at least 3 mm below the crest of lingual and buccal plates. So most of the people get their wisdom teeth removed because they don't have enough room to come and it can grow in a way that leads to pain or dental issues. So this is called an impact wisdom tooth. So the difference between a coronectomy and traditional wisdom tooth removal is that coronectomy removes only the crown or visible parts of the tooth, and it leaves the roots intact and in place. So if your wisdom teeth are growing in, talk to your dentist about what they recommend. So depending on the placement of your teeth, they may tell you to get them removed, have a coronectomy, or let your wisdom teeth grow in.
Surgical removal. Surgical removal, it is impacted wisdom teeth that are causing pain or other dental problems, are usually surgically removed. Extraction of a wisdom tooth is usually required for infection or gum disease, which is periodontal disease, involving the wisdom teeth. Tooth decay in partially erupted wisdom teeth, cysts or tumors involving the wisdom teeth that are causing damage to neighboring teeth. Instructions before the procedures. Number 1. You may not have anything to eat or drink, including water, for 8 hours before your appointment. Number 2. For morning surgery, no food or liquids after midnight the night before surgery. Number 3. No smoking for at least 12 hours before oral surgery. Number 4. Pick up prescriptions before hand pain, medications, antibiotics prescribed by your dentist or oral surgeon.
Good day everyone, I am Jessel Visitiacion and I am going to discuss the treatment or management with Miss Toting. So the first one is goal of care. In this subtopic, we are going to discuss the interventions and procedures that the patient would undergo in order to reduce the pain on our wisdom tooth and remove or to extract the wisdom tooth, and also the AMDNA responsibilities. Jaw pain and swelling around the jaw. The goal of care on this is giving or doing cold compress. Wisdom teeth doesn't necessarily need a lot of treatments like drugs or procedures. So by giving cold compress to the patient, we can lessen the swelling and inflammation around the jaw area. It's like a first aid before the patient would do the actual surgery or the extraction, which is the tooth removal. Another thing or remedy that you can use is clove oil, since it contains an anti-inflammatory substance which can help reduce the swelling or the inflammation. The next one is cold compress. For the procedure, as I have said, there is not much to do other than cold compress, since the most basic complications that the patients would experience is swelling and pain. The last one for the nursing goal of care is the AMDNA responsibilities. So the first one is identify and respond to medical and dental emergencies. Sometimes wisdom teeth causes a lot of pain, just like what we experience when we have tooth decay. As an AMDNA, it's our responsibility to identify and respond to the patient's need before the actual surgery. The second one is assist the patient doing the cold compress and also assisting them with the oral examinations. When giving cold compress, we need to help or give a hand to the patient. In oral examinations, we are also gonna be the one to assist to see and gain some background information before they're getting their wisdom teeth extracted. The next topic is pharmacologic treatment. So there are 4 treatments that the patient can buy in order to help reduce the swelling and pain on the wisdom tooth, although some of it needs to have the dentist's prescription. The first one is anesthesia, the second one is local anesthetic, the third one is antibiotic, and the last one is Tylenol or pain relievers.
Complications of having a wisdom tooth. So I have here the first one. So again, I'm gonna explain to you what are some of the complications of having a wisdom tooth. So I have here the first one. Wisdom teeth can damage and realign adjacent teeth. So if left in place, impacted wisdom teeth can cause chronic infections that damage adjacent teeth or cause severe recession of the gums and bone. If the wisdom tooth erupts with no opposing tooth, it may cause accidental cheek biting or may hypererupt, causing disruption of the occlusion or bite of the other teeth. And I have here the second complications of having a wisdom tooth. So I have here the cysts and tumors can develop. So there are a tendency if we are having a wisdom tooth, the cysts and tumors can able to develop. So the wisdom tooth develops in a sac within the tongue, or the jawbone rather. The sac can fill with fluid, forming a cyst that can damage the jawbone, teeth, and nerves. Rarely, a tumor, usually non-cancerous or benign, develops. This complication may require removal of tissue and bone. So I have here the third complications of having a wisdom tooth, because we have here 6 complications of having a wisdom tooth. So the next one is nerve damage can occur. So the inferior alveolar nerve and the trigeminal nerve are the 2 nerves that could become damaged or injured during a wisdom tooth extraction. These nerves are responsible for controlling the sensations of the lower lip, tongue, and chin. Damage to the nerves occur when they are cut or bruised during the procedure. And I have here some questions, or one questions that we can able to relate if we are having a wisdom tooth. So I have here, what happens if your wisdom teeth hit a nerve? This is one of the many people ask about this one. So it can cause pain, a tingling sensation and numbness in your tongue, lower lip, chin, teeth, and gums. The damage is usually temporary, lasting for a few weeks or months. However, it can be permanent if the nerve has been severely damaged. So I have here the second to the last complications of having a wisdom tooth. So if the wisdom crowding affects the development of other teeth. So if the wisdom tooth pushes against the second molar, it may damage the second molar or increase the risk of infection. In that area, this pressure can also cause problems with crowding of the other teeth or require orthodontic treatment to straighten other teeth. And the last complications of having a wisdom tooth is we have here impacted wisdom teeth cause changes in overall bite structure, of course. So however, many patients report changes in their bite after the wisdom teeth are removed. This is especially prevalent in patients whose wisdom teeth were severely impacted, causing pressure on their own or on their other teeth. So patients who have all four wisdom teeth removed at once may also experience a difference in their bite. So again, this is Jiselle Toting, and that would be all for today. Those things that I already mentioned are some complications of having a wisdom tooth. Thank you so much and have a good day.